Hi everyone, I wanted to record while I was in DC. I am in DC for a few days and I am representing APIC Public Policy Committee, and I am meeting with representatives on the Senate and House side that live in Missouri and represent Missouri. And since I'm here, we were going to talk about infection prevention and control and advocate for IEPs everywhere and advocate for things that need to happen in infection prevention and control. So basically, I've met with some representatives. I still have one more to do today. I will walk you through how that kind of goes. When you walk in, they want to know who you're with and what you're doing and probably like what a day in the life of an IEP is. So I discuss what I do as an IEP and what IEPs all over the world do. And then we go into what is an IEP, and we go into what they do regarding public health, regarding surveillance, regarding healthcare associated infections, how we help with emergency management, how we help with environment of care and healthcare, how we are kind of detectives at times, and it's important for us to keep our eyes wide open about clusters or potential outbreaks. We also help staff with PPE, hand hygiene, and education. We work closely with public health. Those are just a few things that I explain to the senators and their senators' aides, usually I don't meet with the senator, they send their aide to talk to me. So, but they usually don't know about IEPs or what infection prevention and control really does. So it's a big education. The next thing I'm asking them based on policy is to look at the infection prevention and control IEP pipeline. So in the next 10 years, a lot of our IPs, 40% of our IPs will be at retirement age. So we're going to lose a lot of great IPs due to retirement. So we need a pipeline in order to fill those positions. So we're looking at an academic pathway or internships into infection prevention field. And we're also asking for possibly some loan forgiveness for individuals that want to go into infectious disease or infection prevention and control or epidemiology, public health, things like that, in order to incentivize people to come and become an infection preventionist. I've also talked to them about long-term care facilities and the lack of infection prevention and control in those facilities. And of course, there was a big light put upon that during the pandemic. I think it was a big spotlight that we saw, and now we need to do something about it. And so right now, most long-term care facilities have someone appointed as the infection prevention and control officer, basically, but they wear many hats, and they're not exclusive to infection prevention and control. They do a lot of other things. And so we are asking that we have an infection preventionist dedicated role in all long-term care facilities across the United States. So we're asking for back on that. And of course, there's going to be training and education involved with these people, and so that we can rise them up and hopefully become a CIC, which is certified in infection prevention and control. There are also some bills we're asking for that have some funding attached, and that's about the National Healthcare Safety Network that we report our hospital-associated infections to. So we're asking about funding for that and for workforce funding. Those are just to name a few things, but I still have a long day here on the Hill, and I just wanted to update you all. So thanks for following, and more to come. Thank you.